Hello and welcome. Join us today for a conversation with Cyndie Pearson. Cyndie is a public health dietitian with Halton Region Health Department. Her work at the region includes food systems, the built environment, household food insecurity, and affordable housing. Cyndie is passionate about income inequality and advocacy for income-based policies that address household food insecurity. This interview complements our recently released Community Data Watch report on household food insecurity, which can be found on our website at www.cdhalton.ca. Now, we hope you'll enjoy this conversation with Cyndie Pearson. Okay. Welcome, everybody. Stephen here from Community Development Halton, and I'm here chatting with Cyndie Pearson of the Halton Region Health Department. Welcome, Cyndie.
Thank you. It's good to be here.
Oh, we're happy to have you here. And
Thanks,
if you're
Stephen.
okay with it, we'll jump right into the first question, if that's okay.
Excellent.
So, Cyndie, what are you working on right now that you're most excited about?
As a dietitian, it's really important to me that all households can afford nutritious foods to potentially live longer and healthier lives. We know more and more households are struggling to afford nutritious foods because of a lack of income, especially after paying for shelter, whether that's mortgage or rent. And household food insecurity is a lack of access to food because of financial constraints. And it's a serious public health problem in Ontario. I'm really interested in getting to the root of the issue, which is addressing a lack of sufficient and consistent income for all households.
Oh, that's powerful. Yeah, that income being such a common denominator with cost of living and affordability, and for food, it's so relevant. Yeah. So,
Exactly.
I mean, you shared a little bit already about this, but why is this important to you?
This is important to me because we know, based on 14 years of Canadian research conducted by the Food Insecurity Policy Research, or PROOF, out of the University of Toronto, that income-based policies that ensure sufficient and consistent income for all households have a positive impact on household food insecurity. And a good federal policy example is Canada's pension system, where food insecurity rates decrease by 50% for low-income Canadians over 65 compared to low-income Canadians under 65. And some other income-based policy examples are a basic income, or increasing minimum wage, increasing low-income income tax rates for the lowest income households, and improving employment standards.
Mm. That's really helpful to like that you've broken down those policy points. Yeah, it definitely some places to start when we're trying to address income. So Cyndie, what's already happening that you'd like to see more of?
I would like to see continued exploration into a national basic income program.
Oh.
Recently, two bills were introduced, one into the House of Commons and one into the Senate, both proposing the development of a framework for a national basic income program. Unfortunately, both bills didn't make it to final reading. But with a basic income program, it's more inclusive of all low-income households versus other policies. An example is the Canada Child Benefit. That's a federal policy that applies to households with children under the age of 18. And that specific policy saw a reduction in the severity of household food insecurity. But again, it was only for households with children under the age of 18, whereas a basic income program applies to all low income households. And we know the probability of a household being food insecure increases as income falls. And the only criterion with a basic income program is having inadequate income. So, of course, it applies to all households that are low income. Another point, a recent report from the Parliamentary Budget Officer on a national basic income program showed it could reduce poverty rates by up to 40%.
Wow.
And that's significant.
40%.
Yes.
I mean, and we don't even have to look too far in the past to see evidence of that potential. Because when we look at, I mean, I don't have the numbers on the top of my head, but when we look at the impact that some of the COVID-19 pandemic relief funding made, like both to addressing food security and poverty overall, we saw some real decreases in those rates, but then followed by a steep increase again once that benefit ended. So, and I think too, like what comes to mind when we think of more inclusive income policies, it really does reduce that stigma associated with different types of poverty people experience if it's available to anyone just based on their income level. So thank you for sharing that. So, just in thinking about some of those policy pieces and the impacts that they can have to the families that you support in your work, what would you like, want, or need from the community to make some of these next steps as successful as they can be?
I would like to see more community members learning about household food insecurity and what are the causes, what are the implications, and what are the required evidence-based policy interventions that are going to address it. And community members can go to Proof to their website and learn more about household food insecurity and why it's a serious public health problem in Ontario. And of course, what are those income-based policies required? I also think it's important for community members to have conversations with family, friends, or in their social circles about household food insecurity. And also, they can write their local member of parliament or member of provincial parliament, indicating their support for income-based policies like increasing minimum wage or implementing a basic income program. And keep in mind, too, we have a federal election coming up, and I think it's important to ask your candidates about income-based policies to address household food insecurity.
Mm-hmm. Those are some really helpful action steps. Thanks for that. So, if folks were to take some of these actions in our communities, from where you stand, what would be the best thing that could happen?
From where I stand, the best thing that could happen is we would see drastic reductions in the rates of household food insecurity because income-based policies were implemented. That would mean more households could afford nutritious food and have the potential to lead longer and healthier lives. Also, I'd like to see increased community awareness and advocacy for income-based solutions to address household food insecurity.
So, last question, Cyndie. Who else is doing important work to address food insecurity in Halton that you appreciate?
Two organizations come to mind that are doing really important work to address poverty. The first I've mentioned earlier, the Food Insecurity Policy Research, or PROOF, out of the University of Toronto. Their lead researcher, Dr. Valerie Tarazic, was recently named a member of the Order of Canada for her contribution to research and leadership to advance evidence-based policy to address household food insecurity in Canada. And the second would be my colleagues with Ontario Dietitians in Public Health, Food Insecurity Work Group. We work collectively to address household food insecurity by advocating for income-based policies, both federally and provincially.
Oh, wow. Well, that's fascinating. It definitely gives us some organizations to check out down the road. So I'll have to include some links in the show notes. Thank you so much, Cyndie. That was great. I really appreciated this conversation, and it's really great to learn more about food security and some of the work that folks like you are doing to make sure people are well fed.
Thank you, Stephen. I really appreciate it.
Likewise.